Aridhia is we're a biomedical informatics company, and really what we're interested in doing is trying to improve the management, clinical management of chronic disease. Our tagline, to some extent, in terms of what we're trying to do, is we say we're clinically led and we're technology driven. So we're taking clinical data, of which there are a lot, and scientific data, of which there are a lot, and working collaboratively with healthcare providers and with academic researchers. So Research Safe Haven is really about how do we combine clinical data on an individual patient or a cohort of patients? How do we combine genetic data, sequence data on those patients? How do we join those clinical and scientific data sets together? But how do we do that in a de-identified and an anonymized way that allows clinical researchers to really work with a rich data set that is representative either of a single individual or a population or a subpopulation of individuals. Very difficult to provide sort of informatics and analytics solutions that are clinically relevant and clinically safe and scientifically fit for purpose if you don't have a way of really involving a sort of multidisciplinary group of people. Because I think, as everyone knows, cancer research is a complex area, and so anything that can be done to ensure collaborative interoperability between the work that's getting done in different centres throughout the country and indeed throughout the world is really important. And the data sets and the data volumes and the complexity of that data continues to increase, and so a lot of that clinical research is now being heavily influenced in terms of its direction by the capabilities of informatics and analytics, so it's crucially important.
I'm the medical director, so my role is really to provide the kind of clinical leadership so that our products are clinically led and sort of technology driven. We're trying to deliver the clinical information that's really relevant for chronic disease management. And the reason that I think that's important is because chronic diseases are really account for the majority of healthcare spend. All the common chronic diseases are increasing in prevalence, not just in the UK but worldwide. And it's becoming unaffordable. And I think people are still not really appreciating quite how unaffordable healthcare is going to become if it continues along the similar trend to the present time. So we need to look at what solutions will be available to allow us to work differently. So my approach is to kind of work with the multidisciplinary team here to provide clinical input and to work with our kind of collaborative partnerships out in the kind of clinical and academic community, whether that's through an academic health science network or whether it's with direct contact with clinicians in NHS organisations. How do we deliver care more effectively? How do we remove the sort of silos of information that currently exist? How do we support healthcare professionals working in different sectors to have a shared record, for example, that allows them to view the same clinical information? How do we put the patient at the centre of all of that? Because currently a lot of information is organisation-centric but not patient-centric. And finally, how do we kind of use that information so we can use it for clinical research and therefore can support such targeted treatment for that individual patient?
So collaboration for kind of research and to be fair, also in the kind of clinical day-to-day kind of management of how we kind of shift healthcare and bioinformatics forward, it seems to be a very strong kind of play. Aridhia is built around that model of academia collaborating with industry and collaboration with healthcare, and I think that's a really strong model. And I think it helps us build products we think are more viable and usable to the community, but also focuses us on the types of problems that are really affecting it and how we can impact on that. In terms of specifics of, say, the Research Safe Haven model, there is no, for me, the data scientist paradigm is that type of mix. It's not one person. Finding one person who has all the skills is very difficult. And healthcare carries a lot of domain knowledge. so it needs that kind of clinical expertise. Bringing in genomic data is a very specialist kind of skill set in bioinformatics, but they may not have the programming skills. The same with the epidemiologists. They may not have programming statistics or SQL. They'll have statistics, but they wouldn't necessarily have SQL. But now we're bringing in newer skill sets like MapR or kind of Hadoop skills, which those types of users and researchers are not going to be used to. So I think it needs us to build solutions for the research community that almost hides a lot of that layer but kind of exposes it to them. So for instance, in Scotland, there's research projects that are going on across as a national project, so it involves 4 or 5 universities. So you're having a central kind of platform where all those researchers can come to collaborate rather than working on their own desktop, disconnected from the rest of their team. So it's multiple copies of the data, sharing of code, collaboration and knowledge of all that knowledge base.
So there's great work happening in universities, cutting edge kind of science, cutting edge techniques in terms of sequencing the human and other genomes, extracting data from that, identifying biomarkers. That's great work. To turn that into something that can be routinely used and reliably used in diagnosis beyond very specialist rare diseases is going to be a challenge. And from a technology point of view, that means having scalable infrastructure that can be made available to healthcare providers. It means working with the equipment manufacturers who do the high throughput sequencing and integrating that with the kind of informatics platform. It means providing the analytic tools that often are quite bespoke because they come from the lab. So a lot of people talk about kind of lab to the bedside. There's a kind of lab to the kind of core facility within the healthcare provider, and then to the bedside. And we're kind of at the first hop of that at this stage. I suppose my focus is on making data more productive, making it more informative. To me, that's about connecting silos of data, but also extracting information from new emerging data types and bring those rich data types into the electronic health record. So that includes images like X-rays or genetic data. But the promise is there to make IT systems more useful in routine care if we can give clinicians the data they need to kind of not just move paper records onto electronic systems generically, but to give them structured data that can be analysed over a long period of time to identify the pathways for a disease or pathways of care.
From my point of view, on the technical side, EMC Greenplum have done a fantastic job in terms of that packaging exercise and creating that platform that allows people like Aridhia to build their services and their tools and their analytics expertise.
It's really good for us to look at how can we take our products that we know we want to build and have the kind of platform that will support our requirements in terms of scalability and analytic capabilities for big data. I think as well it comes back to that collaborative relationship, because I think the really most important thing for us is to be able to work well with kind of a partner company and to have the ability to kind of bounce ideas off each other, and I think we have that with Greenplum.
It does what it says on the packet, that it I like the appliance model. I think works well for our kind of health system partners. As a technology mix, it's very interesting. The combination of fast analytical database and the kind of emerging Hadoop technologies for information extraction makes so much sense to me. The openness of the platform, the ability to deploy the best type of code for the task at hand.
So the best thing for me for EMC Greenplum is the combination of structured, unstructured, and the big data analytics and the collaboration tools. It's the suite of products we can integrate together and what that provides us as a back end.
For me, there's a very strong business and technical driver to make that change onto the Greenplum platform. We've run sort of development trials sort of during 2012. We've been very pleased with the results of that. We've been even more pleased with the level of cooperation and collaboration with our friends at Greenplum. That's been fantastic.